Hello, it's Dr. Gay from First Look MRI, and this is a 40-year-old female who has complaints of pain. She was playing sports and pushed off and had felt a rip in the back of her leg. As we look on this, we see an MRI of the tibia. This is the main big bone of the leg coming down. It looks normal. There's no marrow edema in the tibia. We see the fibula, this other little bone over here. The fibula looks good. There's no stress fracture. But we do see an abnormality over here. This is the medial side, the medial calf. And we see that there is hemorrhage or edema over here in the medial calf. And if we roll backwards a little bit, we see that the medial gastrocnemius muscle, which is right here, is torn and stripped. It's just elevated right off, like peeled off of the underlying muscle. So this is the soleus, this is the medial gastrocnemius, and we see that there is hemorrhage or edema surrounding the muscle. The muscle is torn. There's a black line here, which is the Achilles tendon, and we should see this coming all the way down, and it has a very short central tendon that attaches to this, but instead it's torn and retracted up about 1 centimeter here, and all outlined or surrounded by edema or hemorrhage. Also, we see this feather-like abnormal signal throughout the muscle fibers, and this is a muscle strain, a partial tearing of the muscle fibers. And this is what we call tennis leg. When they push off with their calf muscles, they contract and it can rip back here. Sometimes it's this muscle, and sometimes you get hemorrhage in other muscles back here. But this is a fairly common injury. Often when we see it, it's just a real subtle amount of edema right where it attaches down here low, or maybe a little injury within the muscle. But this is pretty severe, where it looks like it's just completely stripped right off and elevated, surrounded by hemorrhage. And these usually will heal over time when they're not severe. This is another view, the same thing, just a bigger field of view. We can see the knee, ankle, and we see this medial gastrocnemius muscle that's again peeled right off and elevated, and we see some hemorrhage that's surrounding it, and just with gravity, the blood products and edema go all the way down here throughout the leg and go here around the ankle and into the foot. So significant injury here. This is a short axis view where we can see the same things. We see the anterior muscles, the tibia, the big leg bone, the small leg bone, the fibula. We see the soleus muscle here, which is dark and looks normal. We see another small muscle over here laterally and posteriorly. This is the back. We see the lateral gastrocnemius, and we see the medial gastrocnemius, which is torn. See how foggy and bright it is? So that is edema and partial tearing of the muscle belly. And that central tendon, this black line over here, is torn back over here. And if we come to the very bottom, we see the end of it here, and we see it does not connect up. So this is a bad tennis leg with tearing and uplifting of the medial gastrocnemius. Thank you very much.